I did almost die. I did. My doctor told me that I remember her walking in and saying, "We almost lost you twice." And my eyes were like, "What do you mean twice?"
This is a women's healthcare crisis.
The recent numbers in a report were staggering. It showed a drastic increase, 147 deaths in a single year, a record high for Texas. That startling statistic forced the Texas Health and Human Services Commission to react. So the state created a new way to look at the numbers and found they weren't that high, leaving only 56 women on the list. Thank you for joining us for a special edition of State of Texas. I'm Josh Hinkle. Today I'm joined by investigators Sarah Rafiq and Arzo Dost, who are taking a close look at this women's health concern.
Yes, Josh, we wanted to know what happened to the women erased from the list.
Don't their deaths matter, and are the numbers truly getting better?
Couldn't their stories still help future mothers from becoming statistics too?
We met in 2011, got married in 2014, and then enjoyed married life as much as possible. We knew we wanted to, we weren't quite sure when. We knew it would just kind of happen. And then I think...
And then it happened.
Yeah. And we were surprised with twins. I was very excited and then nervous when I found out I was having two. Our goal date was February 5th or 8th. So January 17th, I went in for what I thought was going to be a routine visit. And I remember the doctor looking at me and she said, and I think we're gonna have the babies today. And I remember telling her, no, we're not having the babies today. Like, they're not ready, I'm not ready.
At some point, the room fills out with doctors, and I'm getting worried because there's a lot of people in the room, and really, they're moving around. They look a little anxious. So then I got anxious, and I asked the doctor, is she okay? They came in to get me, hey, your wife gave birth, and the kids are fine, and they're, finishing up the surgery.
I basically never woke up from the surgery. I never fully regained consciousness. I think I was kind of in and out, and then my organs started failing, and immediately I was put into a medically induced coma because it was that bad.
Leah was diagnosed with HELLP syndrome, often linked to the more common condition, preeclampsia. It causes high blood pressure, severe swelling, and can be deadly.
I was in the ICU for
About 10 days.
Or 19 and a half.
So I was making videos of the kids, even if they were crying, and I was just playing the videos at night to you, and I was hoping that throughout all that you would hear them or you would notice them.
I had them on January 17th. On January 31st, I got to meet my babies for the first time. I remember them bringing them to me, and they put both of them in my arms, and I didn't have the strength to hold them, so they had to put lots of pillows. So they had to request extra pillows to put underneath my arms. And it was such a great moment to know. It was like that was the time when I looked at them. I knew that that's when I needed to fight hard, because I still didn't fully understand what was going on, and I didn't realize how sick I was. But I knew that these two little people needed me. Holding them, and when I first started talking, my voice was very shallow from being intubated for a really long time, so I practically whispered. And I remember saying hi to them, and both of them opened their eyes and looked at me. And it was the best feeling in the world.
Leah was lucky. Many women don't make it, and not all of their stories are so clear. which is why a state task force started removing some names. In many cases, researchers said there was no evidence of a pregnancy. Others, there just wasn't enough information. And other women died more than 42 days after giving birth, the international standard for labeling a maternal death.
How confident is the state in the numbers?
So based on what we have done in the enhanced method, we're confident in the methodology. Do additional data analyses, we do extend that time period because we know that there's additional information that's very important that can help us in the work that we're doing. We know that one death is one death too many. So we know that there is work to be done and we know that we can do better.
I had a blood clot in my lung, apparently, and I stopped breathing.
It's like one moment I'm in labor and the next moment I wake up and my son's there and I don't remember really what happened.
I was 1 year postpartum and I was 34 years old, and all of a sudden I had the signs of a heart attack.
I was terrified. I didn't want to fall asleep even though I was exhausted because I was afraid I wouldn't wake back up.
My experience was a little shocking. I felt like I was having a heart attack, like I couldn't breathe. And I had to scream, I had to beg for help to say something is wrong, I'm not gonna make it. I literally could have died from that. I could have gone into full cardiac arrest. And I would have been one of those statistics. And so when the report came across my desk, my freshman term, it really was very riveting to me. It's shocking that we still don't really have the most reliable data in Texas. And so that's one of the things that I'm going to be working on next session, is trying to create a centralized data registry.
Representative Thury wants that registry to include mothers the state has removed from its official list, because broader statistics could highlight the severity of maternal deaths, perhaps setting a new standard beyond Texas and prompting more awareness and training. How can you disregard those numbers?
Well, that's part of the problem. That's why we need the data registry and the data bank. Right now, if a woman were to pass away 43 days after she gave birth, that's not considered a maternal mortality, even if it was a pregnancy-related death. I've got a bill right now. I've got legislation that I'm requesting. My office is working on this as we speak. What I want to do is, I think something bold has to happen. We have to have cultural competency training, starting at our medical school levels, all the way into our current profession. One of the most important things we found, and I want everyone to be aware of this, is that the majority of the deaths, whether the women were Caucasian, African American, Hispanic, Asian, the majority of the deaths were preventable.
All right, guys, we've got 1 more minute in this round. 1 more minute.
I was never sick. I was active. I was a fitness instructor, nutritionist. I mean, I did everything by the books.
Here we go, guys.
I never even considered dying. I never thought that I could get this sick. I mean, I never thought that I'd be fighting for my life.
Yum.
I'm not sure it could have been preventable, but I think it might have not been as severe. If I was educated on what to look for, and sometimes I wonder, like, why me? And then sometimes I think maybe, not that I was supposed to go through it, but now I'm getting to educate other people.
Lawmakers are considering Representative Thury's bill right now in the legislative session.
Keep in mind, all those numbers we mentioned are just from 1 year, 2012. The state is now looking at deaths in other years to see if those numbers will change too.
And this year, the state is also rolling out a new system with an extra verification step that prompts anyone who fills out a death certificate to confirm a pregnancy before submitting a death record. Arzo, Sarah, thank you very much.
I still remember it like it was yesterday. I was woken early in the morning. I was vomiting sweating profusely. My chest hurt, my left arm hurt, between my shoulder blades hurt.
And I heard them say 5 pounds and 3 ounces. And I heard her cry. And then I stopped fighting to stay awake. I had a blood clot in my lung, apparently, and I stopped breathing.
Right now, like, I'm pregnant with my second child, and I'm being monitored more, and I just hope this experience doesn't happen again.
My son is 5 years old now, and for over 3 years, I had to deal with this heart condition that was most likely triggered from my pregnancy.
Why do we have a high maternal mortality rate in Texas and in the United States? I believe, number one, it is due to just not knowing. Not enough women know about these issues.
Welcome back. This morning we are taking a closer look at what some see as a health care crisis in Texas, women's health and maternal deaths. As state lawmakers consider a string of bills to address this issue, we're joined by two leaders keeping it top of mind this session. First up, Representative Stephanie Click is a Republican from the Fort Worth area and a member of the Health and Human Services Committee. Thank you for joining us.
Thanks for having me.
This session, what kind of focus are we going to see on women's health?
I think you're going to see more focus on some of the maternal morbidity and mortality. During the special session that we had last time, the work of that task force was extended. And now we get to go about putting in place some of the recommendations of that task force this session.
Now you have a healthcare background.
That's correct. I'm a registered nurse.
And so do you feel like you have some kind of personal commitment to this, dealing with patients who have gone through things like this?
You know, it's an important issue, and there are many things that we can do to prevent complications. And even as a taxpayer, it is less costly to prevent those expensive complications that could harm both mother or child.
I know when these numbers came out from the original report from back in 2012, they were very high.
Yes.
And then they came back down because of looking at these numbers a little bit more. Did that concern you that there was such a disconnect between those two things?
It did, but once they had to do individual case reviews to determine whether the complication was in fact pregnancy related. There were a number of folks on there that were like their life was lost in a car accident, which really doesn't have a direct impact on, due to the pregnancy.
Some of the women that were taken off of the list were taken off because their death happened after that 42-day mark, when that's kind of the international standard for a maternal death.
Part of the problem is you've got different standards at the federal level and at the state level. And part of the work of the task force was reconciling some of those differences.
Do you think that that 42-day cutoff is right?
What we found in doing the individual case reviews is there were a high number of women that actually died well beyond the 42-day period, and that we needed to consider whether or not additional measures needed to be put in place.
Is that part of the discussion now as we move forward and figure out what women are going to be counted towards studies, and are we going to consider these women in future pieces of legislation funding?
I think you will. There has been a great deal of discussion about those that are on Medicaid extending their coverage to 1 year versus just the 42 days and then transferring them into one of the other programs. Some of these folks have long-term hypertension, blood pressure problems. They're more likely to have long-term complications, and making access to care available to those at greatest risk.
Now, when you talk about Medicaid, what is the importance of Medicaid for this particular group of women?
Well, Medicaid does pay for a huge majority of the births in this state.
Medicaid can also be a very touchy subject when we talk about funding for it.
It can be, but you have to be strategic in how you spend those dollars, and doing some more preventive type services for that population can reduce cost. One of the other surprises in the task force work was the number of women that died due to opioid overdose. And you're going to see a lot of work done in a variety of bills on that topic this session.
Opioid overdose as a mother or after you've become a mother?
Some of the women that were looked at in the task force case review had actually died of opioid overdoses.
Well, as a member of the Health and Human Services Committee, clearly you've got a lot you're going to be tackling this session. We will definitely have to check back in with you.
Thank you.
Thank you. This is truly a bipartisan issue. Earlier, we introduced you to Democratic Representative Sean Thierry. Our Arzo Dos spoke with her in studio, taking a closer look at her work this session.
Representative Thierry, you've seen it firsthand where race and ethnicity makes a difference.
Unfortunately, this is the elephant in the room that no one is talking about, but it's time now to have that conversation. We have read peer-reviewed articles that now come out and say that implicit bias is playing a part in the maternal outcomes of African American women. And I'm filing legislation this session to change that.
We really don't have a good idea of the numbers of moms surviving or dying. Why is that, and what are you doing to stay in front of this?
Well, in the past, our data collection process, should I say, is less than stellar. So I'm also filing a bill this session that will create a statewide website, a data bank, for example, a registry where hospitals and doctors will report all of the metrics on maternal outcomes, including the births of the babies, and linking the birth certificates to the death certificates. We would have metrics on things such as hemorrhaging, postpartum, all of the factors that are playing a part in this crisis.
Representative Thierry, thank you.
I almost died. Chilling words from these moms who barely survived after childbirth. Many others didn't. It's not just the state looking into what's causing these deaths, so is the federal government. A bill passed by Congress in late December would provide millions of dollars to help states figure out why moms are dying. It's called the Preventing Maternal Deaths Act, and the goal behind it is to collect and analyze data on these deaths. Data collection is also the focus for researchers at the University of Texas. They're using smartphones and a mobile app to track physical activity and social behavior of pregnant women in Austin.
Perhaps it will help us to then identify some changes that can precede something bad happening in the future.
Texas doctors have also sent a list of ideas for state lawmakers to consider this legislative session. And just last month, hundreds of healthcare providers gathered at a conference in Austin, where our Steffi Lee saw a lot of hands-on training.
Do you hear breath sounds?
Every second counts.
Heart rate's beginning to drop.
When keeping a baby in the NICU alive.
You can't practice on the baby. You've got to be good at it before you take care of a real patient.
That's why simulating real-life scenarios, life and death situations, is critical for preparing the teams taking care of the baby.
The trials and tribulations that these little micro preemies go through with so much against them, and to see them grow into a healthy child is just a really, really great feeling.
Delinda Castillo knows that feeling firsthand.
I've had the pleasure of taking care of a patient that has been born at 23 weeks and survived.
Back then, she didn't get this type of practice, but now she's educating others from experience and with this educational opportunity.
How to properly position them, how to gently turn them.
Doctors say simulations can also help teams learn how to respond and recognize pregnancy emergencies.
We had a situation where a patient was injured by a motor vehicle, and our team really responded very rapidly to that situation and was able to save the patient and her baby.
Texas health officials have requested additional funding this year to prevent more deaths of pregnant women, no matter how rare.
That once a year when it happens, we need to know what to do.
Steffi Lee for State of Texas.
Coming up, hear from more mothers who say they barely survived childbirth and find out how you can share your story.
I was in tears. My husband was sitting beside me with our son, and I remember saying, please, please, if anything happens to me, no matter what, just please take care of him and give him a good life. I thought that I was going to die.
I was discharged from the hospital, and that's when things got worse. My legs and my whole body started swelling. My legs were so heavy. My family was trying to hold me up to help me walk around. I couldn't even take care of my newborn baby.
I blacked out and fainted in the wheelchair in the middle of the NICU. My sister had my baby. She called for the nurses. They actually called the chaplain to come and sit with my husband and my sister and pray, because I was in a pretty serious situation.
We went home, and the first couple of days later, I started to hemorrhage. I woke up from a slight little nap and had blood just pouring out of me. I literally shook death's hand.
We worked with ProPublica to find the women you met in our story. Now you can help other mothers and the state better understand this problem by sending us a video diary. Maybe you've had a complication with pregnancy that risked your life, or maybe you know someone who died after giving birth. Upload your video now by clicking into the link on this story on your station's homepage. Thank you for watching this special edition of State of Texas. Have a great day.